Good afternoon and welcome everyone to the 5th annual Islip Goes Purple event here in our wonderful town of Islip. And let us begin with a moment of silence, if you wouldn't mind, in memory of all those who unfortunately have lost their lives in the fight. Thank you. I'd like to begin by recognizing some of our distinguished guests and elected officials who have joined us today, and our community leaders, those who have taken the time to join us. Let me begin with the members of the town board who have been very, very supportive of the efforts of the task force, our opioid task force. And let me begin with our senior member, Councilman John Cochran, Councilman Jim O'Connor, Councilman Jorge Guadron, Councilman John Lorenzo. Also our town clerk, Olga Murray, and our receiver of taxes, Andy Whitman. On his way and joining us will be Suffolk County District Attorney Ray Tierney. We also have with us New York State Assemblyman Jared Gandolfo, and from Congressman Andrew Garbarino's office, who unfortunately could not be with us today, his district director, Leslie. Thank you so much, Lindsay, rather. Also on his way, New York State Assemblyman Mike Durso. He sent someone to beep on his behalf. The CEO of the J.K. Foundation, Kathy Konisdorf. From Southside Hospital, South Shore University Hospital, and the Northwell Health System, Dr. Jacqueline Jason, who's the Director of Addiction Services. Also, Michael Scapelli, the Executive Director of South Oaks, and Angela Mandelos from South Shore University, who's also a member of our task force. And from Good Sam, Chris is here today. Justin Jason, who's a member of our task force. Good Samaritan University Hospital has also been very participatory. The Executive Director of Youth Enrichment Services and the Chair of the Opioid Task Force, Mary Ann Pfeiffer. We have a wonderful partnership, too, with our schools, and from the Connecticut School District, the new superintendent, Dr. Joe Senamore, who is also joining us on the task force. Thank you so much. And from Outreach, I want to also welcome and thank him for his efforts, David Vizzini. From the Islip School District, Superintendent Dennis O'Hara. From Jones Hollow Realty, Brad Wilson, the men in purple. And also joining us, and you'll hear from her later, Carmen, who's a client from Outreach. So today, if I've missed anyone, I apologize. I also want to thank all of the commissioners who have been so supportive, our public safety commissioners, Tony Prudenti, Deputy Rich Bastides, of course, Parks and Public Works, Tom Owens, Deirdre Wahlberg, Carol Charchalis, the incredible team, the Supervisor's office, who's been very, very helpful, Nicole, PIO, Caroline and her team. It really, really, really is a team effort. Today is very significant and meaningful for our community because it marks the town's kickoff for the annual Islip Goes Purple, where we turn our communities and our beautiful town hall cupola purple for the month of September for recovery and mental health awareness. Islip Goes Purple symbolizes our continued commitment to stand together, united in memory of the lives lost, those in recovery, those struggling, and the families throughout the town and really across Long Island who have been impacted by mental illness and struggling with mental health, and those affected by substance abuse disorder. And it does not discriminate. It can affect anyone, regardless of economic or social status. For the last 4 years, our community members, business owners, and community partners, and I want to particularly shout out to the business community who have really embraced it, like their stores Purple, the Chambers of Commerce, Islip, Liz Mayotte, West Islip, Rich Carpenter, all of the chambers that have stepped up and been a part of this. They've been very, very helpful, and these partners have been pivotal in the success of Islip Goes Purple, which is one way we can come together as a community. And this effort, not surprisingly, has grown throughout Nassau and Suffolk Counties, with the town of Brookhaven, Babylon, and Huntington Townships following the town of Islip and lighting their communities purple, along with Nassau County's Massapequa Park in the town of Oyster Bay. We're also joined here today by the superintendent from Brentwood Schools. I see him there, Rich Lochner. East Islip Schools, Paul Manzo. Dennis, you got a shout out already before you even walked up. And if I missed anybody, just get your name up to me, because I really do want everyone to know how this really is everyone coming together. Having elected officials joining with us here today is testament to the fact that substance abuse disorder, mental illness, and caring for one's own mental health are issues that are at the forefront, and we must continue to address these issues, and that we're also willing to tackle them. These tragedies don't happen to other people, they happen to people like us. All of us have been touched in some way by loss due to overdose or suicide. We're making strides, but we have to do more, and we have more to do. The New York State Overdose Awareness Day is September 13th, next week, so we've asked all our school districts to reach out to their school district personnel, to our partners in the schools, to wear purple on that day. These school districts will also have Islip Goes Purple flags displayed on their campuses. New York State will light landmarks purple across the state, and we're asking our local businesses and community and civic groups, as they have in the past, to help spread the word and join us in displaying purple. The Town of Islip Opioid Task Force also provides targeted Narcan distribution year-round. We've also added harm reduction strategies to detect harmful additives, preventing overdose deaths and saving lives. The 9/11 Good Samaritan laws allow people to call 911 without fear of arrest if they are having a drug or alcohol overdose episode that requires emergency medical care, or if they witness someone who is overdosing. Youth Enrichment Services Counseling Center here in the town of Islip has opened in the hamlet of Brentwood and provides support and referrals and for treatment resources. So we have a number of speakers who are going to be brief, but we're going to get through it, who are going to address you today. And I would like to begin with Mary Ann Pfeiffer, as I said, from Youth Enrichment Services, as the Executive Director, who plays a very vital role in the success of Islip Goes Purple and co-chairs our task force. Mary Ann.
I'm loving this turnout. It gets bigger every year. We're so excited running into recovery this year in our heat wave. She's very short.
Really?
So anyway, we're turning up the heat on addiction. She wouldn't say it, so I will. So that's why we have the heat wave. We are going to eradicate this. We're going to eliminate people suffering, families suffering. There are so many resources. I wanted to note that we have 2 facilities right here in the hamlet of Islip at 401 Main Street for mental health, and also in Brentwood. We have outreach. We have Family Service League. We have so many organizations, South Oaks, the Catholic hospital system. There is no reason that we can't support each other and make sure people get the treatment. Instead of waiting till recovery, though recovery works, let's start getting them earlier at prevention and intervention. I want to thank everybody my staff for like literally putting up with me all year when I'm talking about Islip Goes Purple. And the task force members are amazing. Angie Carpenter really designing so many things for us, going out of his way, dealing with this very, very opinionated committee. So thank you out there, Richie. All of my superintendents, you're amazing to work with. You do such an amazing job with the kids, welcoming in anything that makes the lives of our families and kids better. I wanted to call out Dorothy Johnson, who's here from Maxed Out, and Debbie Kavanaugh from the Central Islip Coalition of Good Neighbors, along with all of the chambers. Thank you so much. We have a lot of events planned. Please see the schedule. Next Friday, we have Vibe and Thrive in Brentwood, where we talk about alternatives to just mental health, or in addition to mental health. And on the 17th, the Long Island Ducks, and I know you probably wanted to mention that, are going purple, and joining Islip in this effort. And on the 23rd, run by Herbie Medina and Beyond Sober, we are doing our first walk, Healing Strides, right here at our own East Islip Marina. So a lot of things are planned, Narcan trainings. Any questions? We have lots of materials. Please stop by the table and get a cupcake.
Thank you, Mary Ann. Good recovery. Next, I would like to invite up Dr. Jacqueline Jason, who's the Director of Addiction Services for Northwell Health. Doctor?
Put this up here. Thank you for having me here today. As you've heard, we've made a lot of strides in the fight against addiction, and there's still a lot of work to be done. We're constantly balancing the sadness when we're thinking about the memory of those that we've lost to addiction with the gratitude and hope that we hold for the lives that have been saved thanks to treatment and support and awareness like events like we're here today to be a part of. I would like to share one of those messages of hope from someone who was a graduate of our program and says it better than I possibly ever could. So I'm going to read a letter. Hey, Dr. Jackie. No one calls me that. I'm not sure if you remember me, but I'm sure if you pulled my file, you would be reminded of the most absurd amount of times I've been a patient, not just at South Oaks, but every other Long Island and Florida facility as a result of my heroin addiction that has been plaguing me since the age of 13. You had told me to email you with an update of how I was doing, and I just wanted to let you know, against all odds and logic, I am doing really well. In 25 days, I'm going to have 1 year clean. I've had lengthy time before, but this time is different. It's not a result of white knuckling like before, but rather a result of dedication to putting in the work. I have a car, an apartment, a job, a savings account, no open cases with the law, and I'm in a loving, honest relationship. Beyond all those miracles, I'm at peace. I no longer suffer from crippling, obsessive thinking, and I'm at a point where no matter what, picking up is never an option for me. I want to thank you for working so closely with me and teaching me all the DBT tools I actively practice today. The day before I came into detox, I was shooting up drugs I knew were bad and stopping the hearts of my peers. I had no intention or hope that this visit to you would work successfully, but I listened and finally surrendered, and I've come out stronger on the other side. I think one of the most beautiful things we get to experience as addicts is redemption. There's something oddly poetic and empowering about someone who suffers adversity but has the strength to come out on the other side, not shattered, but rather completely whole. I'm thankful to you and all of your staff for giving me another chance, for always accepting my call for help, even during times I'm not sure I was believing it myself. You never know when someone's just going to get it. I would also like to report that this person sent us another follow-up letter 1 year later. I'm not going to read the whole thing. I'm very, very happy to report things are still very, very good. I was lucky enough to celebrate 2 years clean, and I'm now gearing up towards 2.5. The successful journey has in fact continued. The relationship I mentioned in my last email is now a happy engagement. The great job I mentioned is now a different, better job with a different, better company that I moved on to after being promoted twice. But beyond greater job titles and a significantly better pay grade is a greater developed self-esteem and the wherewithal to know when it's time to move on when you deserve better, a greater understanding of self-worth. That's true magic. And even though the apartment and the car I've previously mentioned may be the same, I know they're just material items that went from things I was missing, yearning for an active addiction, to symbols of stability, representations of consistency, and that's priceless. It's funny how even the things that stay the same from early recovery can take on a new meaning. It's all perspective, a humbling one at that, and I'm entirely grateful. He left us with saying that you realize that you suddenly don't feel so small, so insignificant. You get that fierce feeling that calls you back to peace of mind, that place of peace ringing, anything can happen because anything happens all the time. When people enter treatment, a lot of times there is that sense of hopelessness that we hear in what he's saying. We hear a lot of people expressing that they know what they don't want to be doing anymore, where they don't want to be in life anymore. And we feel really lucky to be able to help support people realizing and actualizing where they want to go and where they want their lives to be, and knowing that they can get there. And I'm just very grateful to be able to have this platform to share that message and that letter and the support of this community to be able to continue that message so that we continue to get more and more letters like this. Thank you.
Thank you so much, Dr. Jackie. That was, I mean, those letters were really inspiring, and again, that whole message of hope that we all have to embrace and realize that there is hope. I would like to ask Carmen, who's a client of Outreach, who wanted to share her story, to please come forward. Carmen?
Hi, my name is Carmen. I'm a 17-year-old high school student from Elmont. My substance use of marijuana, nicotine, and negative behaviors that came along with that began my journey at Outreach 10 months ago. I stopped caring about everything, and I was getting in trouble with my family when I was using. I'm proud to be standing up here, and I have the opportunity to say that I'm 10 months sober and I'm successfully graduating Outreach today. Outreach has given me a new perspective of life and self-love. I've gained coping skills such as crying, which is very hard for me because I've always had a negative look on being vulnerable. Journaling, venting, self-discipline, life skills such as working in the kitchen and what it means to be a leader. Treatment has taught me how to have a good time without substances, coming to a realization that drugs weren't helping me. They were digging me in deeper holes. It taught me that drugs were not the cure to sadness. Drugs only gave me temporary fix to things, with the problem still existing when the high wears off. Treatment has revealed a whole new path for me, and most importantly, it helped fix my relationship with my family. My goals for after treatment is to finish high school while getting a part-time job and beginning a savings account. After high school, I plan to go to college and enroll in a nursing program or join the Army. I just want to end this off by saying thank you to Outreach, thank you to my family, thank you for all the staff and the peers that supported me along my 10-month-long journey, and yeah.
That was very, very brave, and we're very, very appreciative. Let's hear it one more time for Carmen. And for Dave and his team at Outreach that helped make those wonderful, positive stories happen. Dr. Jackie, Dave, everyone who's in the field has to have such a wonderful feeling because they've saved a life. They've saved so many lives. They've made such an incredible, incredible difference. And we're very grateful for the work that you do. I would like to bring up our next speaker, someone who is absolutely vigilant in the fight against drugs in this county, who isn't letting the bad guys off the hook, who's doing what needs to be done It's been difficult for us as a town when we have a state that decides to legalize marijuana. It took a lot of courage on the part of this town board behind me to support me and the rest of us in our effort to say no, to opt out from marijuana in the town of Islip, and we're very, very proud of it. Because we all know that marijuana is a gateway drug. And even though we're constantly getting emails and calls for people to come in and change our minds that we're losing tax revenues, that's not the right way to sustain the credit worthiness of our town on the backs of the lives of people. And I want to bring up a gentleman, again, who is so committed to the residents of Suffolk County from one end of the island to the other, and that's our DA, our District Attorney, Ray Tierney. Ray?
Thank you, Angie, and thank you, everyone, for coming. You know, it's so great to pull up and to see the response for this. I'm a little taller than you. It's so great to see the response, because this is really important. You know, the opioid overdose epidemic in this country, in this state, and in this county is truly mind-boggling. We've had about 399 deaths and counting from opioid overdoses last year. We had 30 homicide deaths. So that means more than one of our citizens in Suffolk County a day is dying from opioid overdose, an opioid overdose, and that's far, far too many. And I want to thank Angie, and I want to thank the town board and everyone from Islip, because as the district attorney, I am blessed with such great partners, and we are in this fight together, and we are going to continue to fight. And you know, some of the things we talk about are some of the things we need a death by dealer statute. We need to hold people in jail who choose to deal some of these deadly drugs on our streets, such as fentanyl, nitazene, and other drugs. But we also need to make these drugs illegal. Now, all of these drugs, such as nitazene, xylazine, fentanyl, all of these drugs are made in a lab. And they're hundreds of times more deadly than the drugs that even were on the streets when I was a young man. And many of these drugs are not even illegal. So we need to change that, and we need to legislate against that and work with our partners in Albany and tell our partners in Albany, you can't just talk about public safety. You can't pay lip service to public safety. You actually have to do something about that. And so we're going to urge them to do that. But having said that, there's only so much I can do as district attorney, because when you're talking about the people who are dealing all of these deadly drugs and holding those people criminally responsible, that's great. But what about everyone else? What about all the other people? What about all of the people who are addicted to these powerful substances? Are we giving them the addiction services that they need? Absolutely not. We are not. So that's something we need to talk about. So we'll continue to do that in the days that follow. We're going to go up to Albany. We're going to talk to our legislators, and we're going to ask them, help us, not only with regard to the criminal legislation, but also help us. You know, there is this move to take all the money out of the prisons, which is all well and good. But where did that money go? All the money that came out, all the millions of dollars that came out of the prisons, did they go to mental health services? Did they go to addiction services? They most certainly did not. So we have to talk to our partners in Albany, and we have to ask them for help, and we have to continue to fight here. And I'm so thankful to Angie, I'm so thankful to the town board, and I'm so thankful for all of you who are committed to this fight as well. So thank you all very much.
Thank you so much, District Attorney. It really, really means a lot. I mean, this is a big county and a lot of issues and a lot going on, but when the District Attorney takes the time to lend his support to an effort like this, you know it's meaningful. and Mr. District Attorney. We have two state legislators who I know took the time again to be here today, are fathers of young children. They know what it's all about, and they are fighting for us in Albany, and that's Assemblyman Mike Durso, Assemblyman Jared Gandolfo. And for those state officials who are not here, we can count on them to share with them the breadth of support across businesses and community groups and our schools, to have so many superintendents here. This is where we're going to make a difference, everyone pulling together. And I'm going to bring up someone to finish up the speeches today, Kathy Connersdorf, who heads up the Jake K Foundation, who unfortunately suffered the tragic loss that parents always fear for. And she has taken that loss and turned it around to something positive, as Dorothy, who we did a shout out to earlier, has done. And we can't thank you enough for your bravery, for your caring, for your compassion. Kathy.
Hello, my name is Kathy Koningsdorf. I'm an East Islip mom. I went through East Islip High School. I raised my kids here. I had a great speech prepared, so I'm going to have to wing this now because I have no internet, so I can't read my phone. It's too small. So anyhow, I raised my kids here, and my son, who graduated in 2009 from East Islip High School, passed away at 21 years old to a heroin overdose. He did not pass away in our town. As many young children, he wasn't a child, as many young adults will do, they will try a geographical change. He died about 5 states away. In this 10-year journey, I have found purpose helping people who suffer with substance use disorder find their purpose. I have dealt with many families. I give support to grieving families, families in the struggle. It's my healing. And if I can help somebody else heal, then, you know, maybe that's my life's calling. I don't even know what to call it. There was a study that came out a couple of weeks ago, and I think it was on the news, and it was by the KFF, which is the Kaiser Family Foundation. And our 21 numbers for overdose were like 107,000 people in a 12-month period, biggest period ever. Well, Kaiser found out that 2022 surpassed it by 2,000 people. They polled 1,500 random people across the United States. 66% were directly affected themselves or by a direct family member. That's an astronomical number, and that number can't be accurate because the mom who's running to the ER, the dad who's trying to figure out where their kid is and what's going on because they're just missing for days, they're not filling out surveys. So 66% cannot possibly be accurate because I know the people I talk to every day, they're not talking to anybody but me. So it's bad, but we can do this because if we empower that 66% plus to get knowledge and education and support and come out to something like this and raise their hand and say, I'm struggling, we can make a big difference. I just want to end with a quick story, and I don't know the whole story, but it always was so profound to me. And it's a story of a guy at a river, and he's downstream, and people are in the river, and they're drowning, and he's reaching, and he's pulling, and he's reaching, and he's pulling all these people out. Somebody walks up to him and says, have you ever thought to go up the river and find out why they're falling in? That's what we need to do. We need to find out why they're falling in. We need to get ahead of this. We need to understand why our kids are so stressed that they're turning to escape through alcohol and drugs. And so together, and this task force, let me tell you, it's phenomenal. When I saw this in 2018 in another state, and I came to Angie and Marianne, and I said, they're doing something amazing for the average person on the street today. Let's see if we can do this. And they were all about it, and it's grown every year, and now we have other towns doing it. I couldn't be prouder of my community, but we have work to do. Let's keep going. Thank you.
And we are so very proud of you. And you heard it. If it can come from someone who has suffered the ultimate loss to say we can do it, we can do it. And I just wanted to also ask all those who are on the task force if they would just kind of raise your hand. Again, this is a total team effort, and we do appreciate it. And Councilman Lorenzo is our liaison from the town board to the task force, so thank you, John, for that. So without further ado, I think it's time to hit the switch and turn our cupola purple. And I would ask our town board members to join me and our 2 state representatives and our DA. This will be a joint effort to throw the switch. Okay. 3, 2, 1. Dare we look? Is it purple? I can't see it from where I am, but it's purple. Thank you, everyone, for coming down. There are refreshments. Please help yourselves. God bless you all. Thank you.